And
Everybody, we're
hi,
live. So we're doing our chronic pain panel today, and we have Joe and Jen with us. Um, Jamie is possibly coming. I haven't heard from her, and my sister Nikki is getting purdied up, and she's coming too. Yeah, on
I
camera.
did that already.
Well, I told her, I said, this is me on camera on Wellness Wednesday. I don't do my makeup on purpose because I don't
Yeah.
want it to look like, I don't want people to think that they have to look like that all the time. Do you know what I mean?
Yeah.
Yeah.
I
I want
was
them to
sick,
be
so
like,
I did my Friday video. So
well, that's fine. You're beautiful.
But
I
I'm beautiful.
Good.
How beautiful. I'll be right back.
Okay.
How are you today, Crystal?
I am doing all right. I didn't sleep well, but I did take a nap. That's why I didn't get my little messages to you guys out till about 12:30 because I took. Yeah. So how are you doing?
I'm tired, but I don't feel a whole lot since I've got. I don't know if I mentioned it last time. I, my temporary cap came off, so I've got kind of a live nerve in my mouth.
Ooh. Okay.
So I don't really feel my back and legs over that. I think is what's happening.
Well, that mouth pain, I don't know why it is. I can take any kind of pain, but that
Yeah.
mouth pain, that will bring me down in a second.
Yeah. Mouth pain is totally different. I don't know why, but it just is.
I don't know if it's because it's real close to your brain. I don't know, but it really makes that brain fog makes it 10 times worse.
Well, I
I
think
have figured out if I cover my
it's there too.
that tooth with my tongue and drink out of a straw that it doesn't hurt too bad. So you figure out the weirdest things.
Hi, Jamie.
Oh no, she's still sick. Okay.
Oh, yucky.
No worries, Jamie. It's good
Stomach
to see you.
stomach bug is
Oh,
going around. Andy and I've had it.
We had it too. Yeah.
I'm sorry, Jamie.
I hope you
Feel
feel
better.
better.
Yeah, I think lack of sleep is the big topic today.
Yeah.
We all didn't have good sleep last night.
Yeah.
Oh,
Are you staying in here? Oh my goodness.
all righty. So if I don't catch somebody coming in, feel free to tell me they're in. Because
Okay.
hey, Frugal Mama, how are you doing?
Hey, Frugal Mama.
Love you
Love
too,
you too,
Jamie. So today we're talking about chronic pain and we're taking questions, and this is general. Today is a very general. We don't have a specific topic. We're just going to discuss our chronic pain issues and let you guys pop questions in that you're interested, that you want us to answer or something you want us to talk about. Greetings. So Jamie, you can listen to us if you want. You don't have to pop up here.
Nope.
No, especially if you're sick. I had that stomach bug for about a week. About a week. I couldn't barely eat anything. And I still have, like I said today, I couldn't have coffee because my stomach's still
Yeah.
a little wonky.
It's the worst. Andy and I have had it, I want to say like a week, maybe a little bit longer.
Mm-hmm.
And yeah, it's not fun.
No.
I'm
Okay.
starting to feel better, but
All right. You know what I didn't do is I did not look up articles for us to go through. So let's first talk about what is chronic pain. We did that last week. Chronic pain is pain that you have. It can go away, but it always comes back,
Yeah.
or it can be constant. I have the kind that always comes back. It goes away, but it comes back. And the weather, because mine's arthritis pain, and the weather really, really affects that a lot. I didn't realize last year I was sick with my kidney stones. So, like you said, Joe, that was taking up all my pain receptors or whatever.
Yeah.
I wasn't noticing any of the arthritis symptoms. This year, it is kicking my butt.
Yeah.
It is the swelling, the pain. So mine is the kind that comes and goes. It'll stay for long periods of time or short, and it'll come and go. And the weather really affects my chronic pain. Don't tell me that. I literally slept in the bathroom last night, Jamie.
Yeah, I've been there.
It was
If my bed wasn't 4 feet from my bathroom, I would have slept in mine.
Yeah.
Mine, it was kind of a combination of both normally, but like we were talking about right now, I have a nerve in my mouth exposed. So I know I'm sore. I can feel soreness, but I don't know how it works, but it's like your pain receptors, like you're saying, only know the worst pain right at the moment or whatever.
Adrian, they told my husband the same thing for his back surgery, and he has literally lost over 100 pounds. And we went to the orthopedic surgeon, and he looked at my husband and told him to lose weight, go on a diet like they did, a starvation diet like they did in the concentration camps.
Yeah,
What?
they said it awful nasty to her. To him, that was not good.
Yeah, and then he proceeded to say, "Oh, you could go on a liquid diet like your wife's gonna have to." And I mean, he was beyond horrific.
Hey, Wilma.
Hi, Wilma.
Hey, Wilma. Hey, Wavy.
I'm done with surgeons. If I didn't have to have surgery on my stomach, I wouldn't do it.
Hi, Adrian.
Oh, man, they used to do anybody's knees, but now I got a lot of friends that have had to lose weight to get their knees done. I
didn't have to. I got my right knee done.
They told Andy to. Rhonda's having to.
Really?
Yeah, they won't touch them.
Yeah, unless you're in an emergent situation, they won't do back surgery. They won't do knee surgery. They won't do anything like that. And you have to quit smoking for a minimum of 6 to 9 months, depending on where you are. So
really?
Oh yeah.
Well, this was 5 years ago. The smoking thing was 2 to 6 weeks. Here, I don't know if that's different per state.
It is, because I think ours is only a week.
Ours was 2 to 6 weeks.
When I was told that I needed surgery the first time, they told me that was when I still smoked, and they told me I have to be free from nicotine for 6 months. And then I just quit, and it was no big deal after that. But my brother, he just had neck fusion surgery. Or no, not fusion surgery. They roto-rooted his nerves in his neck. And he had to be off of nicotine for 9 months.
Holy cow.
Yeah. It inhibits healing.
Yeah, it does. I do. I've heard that. My doctors have told me that back when I smoked, that this would be better if you could quit smoking.
Mm-hmm.
6 months?
Yeah, I don't know why it's different places, because I know here it was, like I said, 2 to 6 weeks, and then you said a week where you're at.
I'm pretty sure they said, do you smoke? If you smoke, you got to quit. You got to stop smoking like a week before the surgery.
Yeah, Washington, I want to say, is like 3 months, something like that.
That's crazy. And to get mean and nasty about it, Adrian's comment, if they would fix them, I could move better and lose weight. I totally understand, Adrian. I got one fixed and one needs to be fixed.
That's what my friend was saying. She was like, getting the knee surgery is what I need to do to be able to go to the gym.
Seriously.
And even after that, I had one knee done, Adrian, and I still have a lot of pain. It's been a year, and in March it'll be 2 years. And I still have pain in that knee. Now, it doesn't hurt as much as the knee without surgery, but I still have pain in that knee. So
I had back surgery last January, and on my lower back. And They did a laminectomy, 2-level laminectomy. And I came out in worse pain than when I went in.
I've heard that with your back and your spine that is a possibility. Yeah.
Mm-hmm.
That's one thing I did take care of when I was an electrician. I did go to the chiropractor a lot, like weekly, and we had good insurance then. I couldn't do that now. But that really helped. What's going on here?
My husband had a lot of relief from the chiropractor as well.
Yeah.
And we've done everything. Absolutely everything. We've done acupuncture multiple times.
Mm-hmm.
I haven't done the chiropractor because the chiropractors won't touch me.
Oh.
Because everything is so screwed up.
Yeah.
And then, like I said, my husband's done chiropractic work several times, loves it. I don't know how many times I have been in various forms of physical therapy. It's crazy.
Yeah, they always want to put you in physical therapy before you're eligible for surgery in Michigan. And then once you're eligible, like Jamie said, weight never stopped me from surgery, but her diabetes has. And that is one thing.
Yeah,
that
your A1C has to be at the right level. Luckily and not luckily, now that I'm on insulin, my A1C is 5.7.
I think that right now I have Trulicity, but I lost my insurance, and Medicare, which is what I'm going to be on in March. Right now I'm uninsured, but in March, I don't know if they're going to cover Trulicity. I'm wondering if I'm going to have to start insulin.
They will, but you have to get it pre-authorized. One thing I'm going to say about your Medicare, the second you get it, go get all of your secondary plans and everything and get really, really, really good Medicare, get really good secondary insurance.
I'm looking at,
and you have a 6-month window to do that after you get it.
I'm working, I get it in March, but I'm going to be working with an insurance agency. I tried to go just to what I call it, Aetna. I tried just to go to Aetna, and all the phone numbers take you to insurance agents. Is that? Yeah. So he said that since I don't have to have it till March, that he would call me after all this Medicare sign up stuff that's going on.
Yeah.
So
open enrollment's tough. My sister tomorrow's the last day, so she called this morning like, woohoo, day before last day.
Yeah, it's
they sent me a pamphlet, and I don't know if you guys have Medicare. I had Medicaid.
I know care.
For a year. You have both. Okay. So I had it for a year. I lost it in October, and I'll be eligible for Medicare. I keep getting the words messed up, in March. So I got
age related or disability related?
Disability related.
Okay. So they will usually, when your disability starts, your Medicare starts at the same time.
Mm-hmm. Medicare A.
Yeah. A and B.
A and B.
Not in Michigan. No.
Oh, really?
That's really federal.
Yeah, that's federal.
Doesn't matter.
You don't have a Medicare card at all?
You need to go to the Social Security office and talk to them, because I bet you money your Medicare has already started.
Yeah, A and B should have started.
I just got my Medicare stuff in the mail just now. I just got my card.
That's so weird.
Yeah. It's that you have to be on Social Security in Michigan for 2 years before you're eligible for Medicare. Now, what they assume that you can have Medicaid for those 2 years. Now, for the first year, I did.
It's all federal law, and your Medicare will backdate, but you do have to have disability for 2 years. Yeah. But if your disability was retroactive, it goes back to your disability date.
Well, that's true, but hers wasn't far enough, I don't think.
That's good.
Yeah.
March was when I filed,
Yeah.
and it'll be 2 years this March.
Okay, so that is when your Medicare will start then.
Yeah.
Yeah.
Everybody's gets backdated because it takes so long to get approved. I forgot yours was approved pretty quickly.
Yeah, I had to fight for 5 years.
Oh, mine was
4
approved
years.
pretty quickly because I got a lawyer, and I was on disability from work, and I wanted to go back to work, but it wasn't working out that way. So that's why I didn't apply I went off work in October. That's why I didn't even apply for Social Security till March, which was after my surgery, or maybe it was before my surgery. Because my surgery was like St. Patrick's Day in March. So I must have applied before to get it in March.
The only reason they denied me, I had lawyers from the get, and the only reason that they denied me until we went to court, was because of my age. They could not deny me because of my medical issues. There's 3 diseases on the top 3 list that are automatic. You get boom, unless you're terminal for something. And I have one of those.
Oh, okay. Mine was the arthritis was bad. Well, plus I have the mental health issues.
Yeah.
I have diabetes. I take a lot of medication. Let's just say that. I have a lot of health issues. But
the time I was in the hospital, the nurse comes in and she goes, "You realize you're on 27 different medications?" I was like, "That's all?" I was like, "I've cut back on some."
You keep giving them to me, man.
I know. The doctors, do you guys have this issue? You'll go to the doctor and they'll, new appointment or whatever, and they'll look at your list of stuff and they're like, "Oh my gosh, you're on so many meds." And then they prescribe you 4 more.
I know.
Well, mine used to be like that.
Mm-hmm. Yeah. Mine's pretty good. If I tell her something's not working, she'll take me off of it.
Knock on wood.
Yeah, my primary care physician is very good, and it took a lot of years to find a good primary care physician.
Mm-hmm. Amen on that one.
That's why I keep checking the insurance. I'm like, I want to make sure they take the insurance because I don't want to get Medicaid and not be able to go to her.
Yeah.
Medicare. I don't know what my problem is.
All doctors take Medicare.
Okay.
It's if you have Medicaid that they're kind of, I don't know about. The cool thing about Medicare with Medicaid as your secondary is that Medicaid will now cover things that they wouldn't cover before, because if Medicare pays for it, they have to.
Yeah.
Oh, I'm sorry, Wilma.
Yeah. She also wanted to go back to work, and her doctor said no. Yeah, mine is terminal. I was born with a lot of health problems. Boy,
I'm with you on that one, Wilma. I have a birth defect that is directly related to my mother smoking while pregnant.
Oh, wow.
Yeah.
Yeah, Wilma, I do. Yeah. Yeah, it takes forever to find a good doctor. When you find one, that's why I was worried about this Medicare stuff, because I'm like, I started March, but do I have to do it now? Because I only found out like a week ago. I got the paper in the mail, and the insurance guy said no, since it's in March, you can sign up anytime after this. You don't have to sign up during this enrollment period. Or
yeah, that's the great thing about when you and it's the only time it'll ever happen. But when you very, very, very first get on Medicare, you have 6 months to get all of your shit put together.
Mm-hmm.
And it doesn't matter when. You don't have to wait for open enrollment or anything like that. So
I will tell you this: most people don't know. Make sure you get the right supplement, because
that's what I was saying.
I have the top supplement. So if, let's say, I got supplement, I don't know, E or whatever. And later on, I need supplement G. Let's say that was a year. I have
Mhm.
to pay back all that money because I picked the wrong supplement.
Oh my gosh.
Yeah, I didn't. My sister's the one who got a hold to me because I was going to pick. They offered F at the time. They don't offer that anymore here.
Mhm.
Is this
But
me being on the computer, or is it? It's got to be me.
But
Yep.
my sister was like, make sure you get G. And I was like, well, it looked like F was going to be good. She goes, yeah, but if you need that later on, let's say in 20 years, you have to back pay the difference of 20 years between F and G.
And that's the part I don't get. I'm going to get all the stuff.
Yeah.
Because I read that if you just go with, say you don't get a supplement, and you just go with Medicare A and B, when you decide you want a supplement, you do have to back pay. And that is just ridiculous.
It is. It's crazy.
See, I didn't have a choice in my supplement.
Mm-hmm.
Because my supplement was based on our incomes and stuff. And so Medicaid is my secondary.
Yeah.
So I'm hopeful that I can get a tertiary down the line if needed. Luckily, I don't need it at this point because whatever Medicare doesn't pay for, Medicaid does.
Yeah. Well, I'm hoping this insurance agent can help because he said if we talk after this time, he'll have a lot more time to help me because I read that little pamphlet they send you. And I got to tell you, that was the most, I can read directions from IKEA and put furniture together. That was the most confusing thing I've ever read in my life. I will tell you right now.
Hey, that's that. I went to freaking law school. I can understand and read legalese. Yeah. I can't understand that damn Medicare book for nothing.
That thing is so confusing. I'm like, are you kidding me right now?
I'm so lucky that my sister sells all that stuff because just little things like I would have known about the back pay or understood it. I had read something about it, but in my mind, I was like, I'm reading you back pay. That cannot be right. And it ended up being correct.
Oh, they will make you pay for everything.
Oh, yeah.
If they can get out of paying for something, they will.
I've had good luck so far, though.
They have been trying to go after my work comp because I got hurt at work, and they've been trying to go after them forever. And I'm like, no, it's done. It's settled. You can't go after them.
Duchess needs the link.
Who's Duchess? Oh, that's my sister.
But who's beeping?
I don't know.
It's not me.
I'm on my phone like normal.
It's like when your chat goes off 50 million times. It's just a continuous dun dun dun.
Is it me?
It might be.
It sounds like it's in the phone, not my phone, like another phone.
Yeah.
Here, let me go out. I'll go out and I'll come back in.
I've cut everything off, so it shouldn't be me. It's still happening.
I don't hear it here.
Do you have chats going off?
No.
Or game alarms or anything like that?
No, I don't play any games.
Okay.
The banging is my husband, but the beep beep, I hear it.
Yeah. Okay, I have everything. I've closed literally everything on my computer.
When Joe comes back, I'll go out and come back in, and then if it still doesn't clear up, then we'll have you.
Yeah.
Was it me?
No, I don't think so. I don't hear it now. Oh, wait. No, never mind. I spoke too soon.
Okay, I'm going to go out too.
Okay.
So, sister, I'm going to drop the link while I'm out of here.
Do you hear it?
I hear it, but I don't know what it could be on my phone. I can't. There's nothing open.
Yeah, I'm on my computer and I literally shut everything down.
Yeah, everything on my phone, even the notifications I got rid of. I still hear it.
Yep.
Okay, Jen, it's your turn.
Okay.
Yeah, I don't hear it now.
Yeah. All right. I'm trying to get the link for my sister. She got to be a pain in my patootie. I know, right? Okay. Here's this chat. Okay. I know, right? Me talking about her. Not now. Okay. All right. Paste. No. That didn't do it. Yeah, it's definitely gone now.
Yeah.
Maybe it was something like in the kitchen or something going off and she just didn't hear it.
Yeah, I don't know what it was. It really sounded like when you have pop-ups happening, you know?
Yeah. Okay, I'm copying it. Sorry about the lull, guys. If you want to go back and go through the chat, Joe, while I'm doing this and see, I know we missed some people.
I see Adrian and Wavy Like the Ocean and Wilma, Jamie, Frugal Mama, I think I said that. And then your sister just came in.
Yep.
And there's Jen saying, it's me.
We see you, Jen. All right. So let's go back here real quick. Yeah, Wilma, we were talking about Jamie says, I hate that people on Social Security don't get dental. Now, the Medicare is what's going to give me my dental and also my prescriptions and stuff like that. I'm even supposed to get some kind of little card for over-the-counter medications or something like that.
Yeah, you'll get a lot of stuff. And some of it you won't, or at least some of it had to take to my sister, and she just weeded through and threw out what was just crap and what was actually worth something.
Yeah, let me get Jen here. I dropped my link, sister.
I forgot I had my spare phone plugged into the computer.
Okay.
Oh, it was you.
It was me.
I was like, well, the noise is gone now.
Yeah, no, it was me. I'm sorry about that.
You're fine, girl. Yeah, the other night somebody accused me, and I was like, listen, I'm telling you, I don't have anything. There's nothing that I can turn off.
Yeah.
Yeah, I shut everything else off on my computer, and then when I closed everything out after I left the studio, it was still doing it. I was like, my phone's laying right here on top of my computer, and I'm like, suck an egg.
Yeah, Wilma, I've heard somebody else told me a story like that.
Hello, sister.
Hello.
You saw me back there all this time just being still. You want to start bringing me up when I'm messing with my face. Thank you, sister.
Yes, you're welcome. Anytime. See how beautiful she is? She didn't even show her face last time. I said, show your beautiful face.
No.
You look like me. Of
I didn't
course.
even put on my beautiful face. This is my regular face. I didn't even get that
Your
one
regular
yet.
face
all
is beautiful.
beautiful.
She's my sister.
I hard
Yes.
to tell the difference, but this is just my regular face.
If I'm beautiful, you're beautiful. So just don't even say it. So that's how it is.
Well, don't feel bad. I'm supposed to get the same BS. The only thing I get extra is I get a discount for paying for Amazon Prime, and what was it? There was a new thing. Oh, they pay for my internet bill.
Oh, I get that too, though. That's not from Medicare.
No, that's because we have Medicare.
Oh, I gotcha. Yeah, I got that because I'm on disability. Thank you, Wilma.
One day, Jen, somebody else told me that and I tried to find it. I could not find it. If you see that online, will you send me the link to the disability internet? Somebody told me there was a
Call
form.
your internet provider.
Just call them.
Yeah, and say, I need the federal assistance program
Okay.
information, and they'll send you all the stuff.
Okay. Yeah, somebody told me you shouldn't be paying for your internet if you're disabled, and I was like, "What are you talking about?" And I couldn't find the paperwork online.
Well, it'll take
Supposedly-
$30 off.
Oh,
Yeah.
okay.
But our internet service provider lowered our bill. They have a special program that matches it. So
Oh,
our
that's
bill's
cool.
our internet's $29.99, and so there you
So
go.
how you doing today, sister?
I'm doing good. We had some life difficulties before logging in. That's why I'm late.
Isn't that normal?
You know, lunch, and I've got Heather's dog here along with our puppies, and
Oh, she's
he's
got two
old
puppies.
and cranky, and he doesn't get along with the others. So
Oh no.
Angela, yeah. So anyhow, I'm here. I'm here now. I almost didn't make it just because of life. Welcome to my world.
I
I
wouldn't have
didn't make
made
it because of that.
And don't ever remind Crystal to remind you of anything, because she called me today. When I call you on Thursday of last week to tell you to remind me, I don't mean 12 p.m. on Wednesday. That's not what I meant.
I put a
I probably were
message.
prepared. I might have
We
had
were
my
chatting
pretty
about
face.
it in the chat last night.
Yes, I put a message in the chat.
I've been out. I've been off of chats for a week.
Well, and whose fault is that, sister?
Well, I have found where I can watch all my shows I've missed over the last 3 years of not having cable. You know, the stuff that I see only in bits and pieces on YouTube or elsewhere, you know, to where you know you're going to see it, not those ones that like dare you to find something that works like free Peacock and all that type of stuff. We got movies and but they're like nothing interesting, you know.
Mm.
So I
Oh,
finally
TV's
got
pretty cool.
We get Walmart Plus for free because Andy works there. And so that means we get Paramount Plus for free, which is freaking awesome. I'm like, yes.
Who is free with Walmart Plus?
Paramount.
Paramount
But that's
Plus.
not that great. No. I
No,
get
I
see like
watch
the
that,
Ratchet
though.
stuff.
People
No, I
that
get
can't
to watch my
afford it.
Ratchet stuff, my Housewives and Basketball Wives and Love and Hip Hops and you know the Ratchet stuff I've been missing out on.
The best deal as far as internet TV, because we've had a Roku for years now, and by far the best deal that we have found is Max. You get HBO, you get a bunch of the what is it AMC that has The Walking Dead?
Yeah, it's AMC.
Okay, so you get a bunch of their shows, not all of their shows yet, but you get probably about 60% of their shows, and you get all of Discovery Plus, all of it. So they basically merged Mac, HBO, and Discovery Plus. Basically, they merged. So that means you get TLC, Discovery, History Channel stuff.
Ooh, Wilma.
I could go out there and read it all to you.
I know that $30 would make a difference for Wilma.
Oh, yeah. Oh, my gosh.
It's crazy. Housewives are on
$30
Peacock for
a
the
month?
free the Peacock, yeah.
But it's the old ones. It's not the new ones. It's like
Oh no, the brand new ones.
yeah,
Oh,
like the on demand
All
stuff.
the Housewives are on Max.
I got Philo. I'm in the 7-day trial of Philo for $25 a month, but I like it. I can watch everything I love all day long.
Oh, that's good.
The cool
It's a
thing
good
about
deal,
Max
too.
is it has all that stuff too.
But
And
for
then-
$25, it was like
Yeah, that's a good deal.
Max
And you
is 16.
I don't think I mean, I have to have my Ratchet shows, so I have to watch.
Yeah, she
I
said
get, I
Philo
get
was
up. I
working.
tried Paramount for a couple of months,
No,
and I
no, no,
wasn't.
not Paramount. Max has all of the housewife stuff, all of the like 90 Day Fiancés and all that stuff.
Yeah, I know, but they don't have the Ratchet stuff like from MTV and VH1 and BET that I like.
No, that's Paramount.
Yeah.
Yeah.
Paramount has all the MTV stuff. And I watch all that.
Everything has 90 Day Fiance. When I had Paramount, it had 90 Day Fiance, and then they had so many like different things that branched off from that, and I got tired of looking at that stuff. So
Right.
I just get more
Yeah, Wilma.
ridiculous over the
I'm
years.
glad
So I mean, I
that-
can only take so much.
That Philo, is it Philo that you said? Is that how you
Yeah,
said it?
yeah, I really like it.
Once a month? I wish we could do that. My husband likes
Cardi-
You
sports.
can. It's an app you can download on your Roku TV.
I know, but it doesn't have ESPN, NFL Network.
Don't tell me it don't, because it do. It has 70,000 on-demand shits and 70,000
You
channels.
can
It has
get
all
a
of it.
Hulu bundle that has ESPN and Disney Plus and Hulu all together.
Yeah. He needs NFL Network, ESPN, all the Fox News, all the Fox
So you want
Sports.
me to check and see if it's on there later?
You can, yeah.
And now is the time to get into that stuff because all of the channels are doing crazy bundle deals for years.
yeah.
And, you know, because of the
Yeah, we're
holiday-
fixing to do the Disney bundle.
Yeah, we're going to get the Disney Hulu bundle because
You can't beat that right now.
cannot miss my Doctor Who.
Just let you out.
And the bastards put the 3 new seasons with David Tennant on freaking Disney Plus after we just got rid of it.
Right, Wilma?
A-holes.
How do you see your chat, Crystal?
I'm on my computer. I see you guys here in my chat.
Oh, okay.
Yeah, I'm on both my phones.
If you're on your
So-
phone, you can turn it sideways and you'll get chat.
Oh no, Wilma. Yeah, car insurance went up everywhere, honey.
Did I
Oh, God,
lose you?
our car insurance, it's stupid.
Are you
Did you lose me?
You're froze, yeah.
Okay. I was looking. I don't know why I even touched this stupid phone. Now I don't know where I'm at.
If you're just wanting to read chat, it's fine.
Well, it's too late now because now am I frozen? You guys can see me or no?
You're
We can,
frozen. We can see
You're
you, but you're
frozen.
frozen.
and we can hear you.
Yeah. Right. Frugal
I
Mama
got
is
lost.
all going up.
I'm somewhere lost in the metaverse. Someone find me.
She's lost.
You're lost in the StreamYard universe.
Yeah, I think I may have to. I don't even know how to get back to where I'm supposed to
You want
be.
me to bring you down so you can leave and then come back?
You should be able to X out a chat. She's in space, right? Here's my theory on fibromyalgia. It is the doctors. I don't know what you have.
I agree.
don't know what's wrong with you? So this is what you have because they have to label everything.
I mean, I know there's scientific stuff to it, but I also think that it is a fallout for doctors when they cannot explain
It is.
all the situation. Because, like,
It's the same as if they tell you you have idiopathic whatever. Idiopathic very literally means they have no idea what is causing it.
yeah.
They're doing more studies on fibromyalgia.
Oh, yeah, they are. They're right now. There's a pop-up time for it. Thank goodness, because in the past they've just not cared.
Yeah, because they didn't believe you. They didn't
No.
believe you. They didn't. So
Scotty
now
beamed her up. I agree, Wilma.
do you want me to kick you out, Nikki, and you can just come back? Did she?
Oh my
leave?
God, I didn't realize that her name was Nikki. That's my sister's name.
Yeah, she
That's
changed
awesome.
it to Duchess. I'm gonna kick her out and see if she can come back in.
Yeah, that's probably the best
Kick
thing.
from
for her.
studio. Is that what I do?
Yeah. and then she can
Will
just
be removed from the studio. You want to prevent this person from rejoining, you should ban them instead. No, I don't want to ban her. I just want
No.
to kick her out so she can come back
Yeah.
in.
And then she can just re-click the link and she
Yeah.
should be fine.
Yeah.
We'll just have to read her the chat if she doesn't have another device to use.
Yeah. When we start talking though, I miss a lot. So we'll just have to back up and come forward. And
Yeah, that's fine.
So Joe has chronic pain all the time, and she has different types of chronic pain that come and go.
That's
Jen, how is your chronic pain described? Is it all the time? Is it sporadic? What do you have going on?
I have different levels of pain. I have a constant dull yuck throughout my whole body. And then, but especially where I got hurt. And then I have sharp, agonizing, I have neuropathic pain. And so I get the bee stings and all
The
that.
nerve pain, yeah.
Yeah, and the razor blades, and it kills me. But I have these lovely things that's what Joe and I were talking about, why I didn't sleep. I get these spasms that look like I am having a grand mal seizure.
Mm.
And I've had a grand mal seizure, and I would rather have the grand mal seizure because you're not coherent for that.
This
It's
pain.
horrible. My body will flail out. It's kind of like, I don't know, I describe it as Tourette's, but spasms. Because it just randomly, my arm will kick out. It's all nerve related.
Mm-hmm.
And from the nerve damage, it's I lived with a crushed spinal cord for 4 years. I had 3 neurosurgeons flat out ask me how I was still walking.
Yeah.
Because my spinal cord was literally crushed. I'll show you a picture.
And that's the neck area, correct?
Yeah, C3 through C7.
Okay.
So almost to the brainstem.
Yeah. Because that's five vertebrae, so that's a lot.
Yeah.
Uh-huh. And they did a 4-level laminectomy just to allow the spinal cord to swell outwards. Because it's still swollen, it's still shut, basically. But it has a place to go.
Oh, okay.
So
Okay.
instead of being in this space that's this big, now it can go. It could swell as big as I wanted to.
Can expand. Yeah.
Yeah. Eventually, I will have to have a minimum of a 4-level fusion, but the laminectomy was to stay off that as long as we possibly can.
And did the laminectomy, did that decrease your pain at all or increase it or?
Yes and no. It created different pain, but it did decrease the absolute worst pain because before they did the surgery, I had pain that would radiate from my neck all the way down. And then right here in my arm,
Mm-hmm.
it felt like I had been hit by a sledgehammer constantly.
Mm-hmm.
And then, of course, my arm would go dead. I have severe carpal tunnel because of all the nerve damage.
Uh-huh.
So that's another surgery that's coming up. And then also because of the nerve damage, it's crazy what connects to your neck. Literally everything from here down. I have gastroparesis because of both the diabetes and the nerve damage in my neck.
Okay.
So, and it was all caused by one person.
And that's the surgery that you're talking about in the future for your stomach. Is supposed to
Yeah, they're going to be doing gastric bypass to try and help because I don't qualify for a gastric stimulator, which is like a pacemaker, but for your digestive system. Because the manufacturer of the stimulator does not allow people who take any form of pain medication to have the gastric stimulator.
Well, what the heck? Who needs that then?
Right. So instead, I have to have gastric bypass, which, okay, need to lose weight, especially after freaking non-necessary heart surgery. Don't even get me started on that one. But so they're gonna go in and basically they're hoping I get dumping syndrome, which is a side effect of gastric bypass.
And is that like where it just runs through you? Okay. So there'll be no
Runs
stress on
through
your.
you up or down. So I'm trying to find my picture.
Okay. So
There it
Nikki, we're talking about types of chronic pain, like the one that you have all the time, because you have fibromyalgia. I would say that is that an all the time kind of chronic pain? And then like I just have the arthritis pain where sometimes it's worse, sometimes it's not bad. And like with the weather, it gets worse.
My fibromyalgia pain does that.
I think all pain gets worse with the weather. I mean, it's not only cold weather, but like high humidity in the summertime can be challenging.
Yeah.
You know, it's just when your body's you're absorbing all those fluids in those areas because it's trying to protect those areas that you're feeling the pain.
Yeah.
So sometimes it's just better to sit your behind down and
I've been doing
I don't
that.
know about all this surgery. I wouldn't be volunteering for all of that. That's just
So I labeled them. One's normal, where you have the white with the black dot in the middle. That is my C2 vertebrae. So it's perfectly normal the way it's supposed to be. And then if you look at the next one, that is C3 through C7.
Oh, that's a crushed vertebrae.
And it's completely flat.
Okay. Yeah.
That generally will only happen in, and then this is what it has done to my neck. Normally you have a curve in your neck and it kind of goes like this.
Mhm.
Mine curves the opposite way too.
Yeah, mine is completely straight.
Mine curves the opposite way.
Oh,
Yeah,
instead
more
of
like a
like
scoliosis.
this,
Mm,
instead of like that, yours is curving this way.
yeah.
Yeah, that's very common with scoliosis.
I know Jamie
Obviously isn't.
has a lot of neck pain and back pain.
Yeah.
Yeah. So
Her
she was gonna be
about-
here today, but she's real sick today. So
Bless her.
yeah, Frugal Mama, changes in barometric pressure.
Yes, Frugal Mama. I don't understand barometric pressure. I tried to get into the depths of it to figure it out.
Mm-hmm.
But I do know it's true because if it's 70 in the day and 40 at night, I can barely walk.
Mm-hmm. Yeah.
Mine's getting worse because my fibromyalgia from
Yeah.
all of the nerve damage and everything is getting worse. And my neurologist, I have no idea why he did this. He took me off of all of my nerve meds. And I see him tomorrow. And I am literally going to beg. It's for a Botox appointment because I have migraines really bad.
Yeah.
And the Botox really helps. Who the hell gets Botox for cosmetic reasons? You're freaking nuts. Absolutely off your rocker. But it helps with my migraines. But I only have to do it every 3 months. When they do it cosmetically, they have to do it every 3 weeks.
My girlfriend does it all the time, like it ain't nothing.
Does it hurt? I've
It's
never.
like
She has little tears going down her face.
Oh, man.
My neurologist does it, and he starts back here at the base of my neck, and he goes up my neck, all the way up my neck, and then over the ears.
Oh, it's real sensitive right there too. Yeah.
Over the ears to right here, and then he goes all the way over, and then he does them right here and right here. It's 38 shots.
Oh,
and they're just little. They're like insulin needle size, but the stuff. Oh, it's horrible. But anyway, that's actually how my neck is, perfectly straight. You can see there's no curve.
Yeah.
So pretty gnarly. There's a better picture of the crushed. It's
Mm-hmm.
that little black bean in the middle.
Mm-hmm.
Yeah.
Yeah.
And that was caused by one person.
That's all it takes is one thing, and then it's like everything else kind of, it's like a snowball. Like we were talking
Yeah.
about sleep earlier. You don't get enough sleep, you can't get well, or your pain increases. And if your pain increases, then it causes you to be more depressed. And then since you're depressed, you can't sleep. So
Yeah.
and
It's a
around and
vicious
around and
cycle.
around. Vicious
It
cycle.
is. It is a horrible cycle. I think I don't know. I think I sleep maybe 3-4 days a week if I'm
Oh.
lucky, where I actually get to sleep, and then
Oh.
I sleep for a long time, and then I won't sleep for a couple days.
Oh man.
Joe's always telling me, "You need to go to bed."
Yeah. Yeah.
I'm awake, not going to bed. I'm like, you need to sleep. She's like, you haven't slept either.
We go back and forth. You need to.
How's your sleep, sister? Do you get to sleep through the night?
I have I have my days sometimes, but it's usually triggered by, you know, anxiety. So
Yeah.
Oh yeah, I
once I
get
get through
the
those couple of days, then like I went to the dispensary and I
Yeah.
got myself
I do
together
wanna-
and got me some sleep. So
That's
it's just in cycles, really.
okay. Okay. Because I didn't get good sleep last night, but I'm in some pain. I went
Oh
to
yeah, immediately the next day after I didn't sleep the first day, it was like my knee was like messed up, so I'm limping all over the place. You know,
you
then
don't
I'm like,
get
forget it,
deep-
I'm not gonna stand up anymore, not unless I have to. And then you gotta
don't
pee
get that-
3 times.
what is that deep sleep, REM sleep? And that's
The
where
REM
you
sleep.
actually can
Yeah,
start
yeah.
to heal, or at least
Yeah.
pain down, the inflammation down, and things like that.
But then I'll take 3 days and dedicate that to resting and sleeping, and then the recovery time gets shorter.
I don't know about you guys, but I hate having to take the sleep aid meds. I can't take like Ambien and stuff like that because it's all psycho stuff. I can take Trazodone once in a while, and I have 2 different strengths of that, and I take 20 milligrams of melatonin every night. But I can, I can drive on that shit. So
Okay, well, let's talk about the CBD and the THC. Is it
That's what
legal
I
for
was
sale
wondering.
in your state?
yeah, that's what I was wondering.
It's legal in Michigan.
It's only
you say
legal here. It's legal for recreation, just a small amount.
Mm-hmm.
So if you got a green card, would it be different? Would the rules?
No,
be-
there's no medical. It's just recreational and a very small dose of it.
Yeah, we get recreational and medical. I don't have a medical card because recreational is available to me.
Yeah.
The products that I used to have my medical card, and the products that used to be available to me through the medical dispensary, those companies decided, nope, we're going to go into the rec business. And so, sorry, my blood sugar's being stupid, like normal.
So do you go to the recreational dispensaries? I mean,
I do. We don't have one in town because it's our state. I don't know about your guys' states, but our state left it up to local legislation to approve whether or not dispensaries can be in our county.
mhm.
And we have 60 churches in our tiny little community and county. 60 for 16,000 people.
That all need to smoke a joint.
I mean, come on, right? Just go freaking take a gummy and get over yourselves.
So you have to go to the next county, or
Yeah, I have to go to the next county, and the one that I go to when I go towards Idaho, because I live right on the Idaho border and right on the Washington border. If you look at Oregon, there's the corner,
oh, okay, you're in the
eastern
corner.
corner, and I live in that eastern corner. So it's cheaper for me to go buy my products in Washington because they don't tax the ever living shit out of it all than it is to buy it here in Oregon.
But you're
Okay.
allowed to possess it in Oregon, so you can cross the line.
You can't. Every drug is legal in Oregon. Measure 110. I highly recommend you look it up. Literally every single drug on the planet is legal here.
Wow.
Yeah, it's caused all kinds of problems.
So what's going on with you, sister?
I need to make a CBD order because I saw that they got the 200 milligram capsules back in. I don't know if you
I
saw
gotta
that.
get me some of them too. Yeah. Because I
Because
got the
take
100.
Yeah,
the
the
200,
100s
yeah.
are still good. It's just more expensive than if you get the 2. And I take
Okay.
400 milligrams of CBD at night for sleep, and it also decreases the swelling and the pain in my knees and my hands. If I don't take it, if I forget it, man, I know it the next day.
I have found that
Well,
low
maybe you don't need 400 milligrams then. You shouldn't notice it right
To
away.
do less. I've tried to do the 300. It doesn't work as good.
Yeah.
And I only take it that one time.
I found that low dose THC mixed with a higher ratio, like a 70-30 split,
Mm-hmm.
is probably the best combination for my body.
Low
dose THC with high dose CBD. Well, and the other cannabinoids that are in there too.
Mm-hmm.
That's why I like this one so much.
And where do you get that one at? I
get it at the dispensary in Washington. All the Washington dispensaries seem to have this.
Oh, okay.
But it's by Nano. Is the brand.
I've never seen a stick like that in our dispensaries yet. I'm sure it's coming.
Here, I'll type it.
What kind of a stick?
In the chat. It is
a roll-on. They have them with Lazarus.
Yeah, but it's not the same. No, she's going to tell you what's in it. It's got THC and CBD and the other CBN and CBG.
I don't find that. I mean, THC helps with the nausea a lot better, I think. But I mean, CBD in itself is just an amazing type of a therapy that I think everybody should take. You know, I did an experiment with Angela, and she's a bear when it comes time for her to be a bear. And she was so pleasant. And after the very first, I got about 3 weeks before, and then she, it worked, but then she didn't stick to making sure she was taking it every day either.
Right. He had a friend he had never ever done.
That's the thing, you got to take it every day, but I don't know why you're noticing immediately, because it takes but I will take it for 3 months, and then I'll just not make an order and go without it for about a month. And depending on what time of year it is, I can get away with it. But I'm concerned that you're getting pain the very next day if you don't take it.
Yeah,
it doesn't.
I am. Mm-hmm. I don't know if that's a concern. That's just how my body.
You don't take pain meds?
No. I have the CBD roll-on for my arthritis in my hands and my knee. Not the roll-on, but the one we get from Lazarus. And the reason I talk about Lazarus so much, guys, is that if you're on disability, you get is it a 60% or a 40% discount?
It's a ridiculous discount. It's 60% really on most stuff. Yeah.
Yeah. And since our insurances don't cover THC and CBD, it can be expensive. But in Monroe, and I'm sure
not with this app. I mean, if you're buying your CBD at a dispensary, and for what, I mean, we can get a 200 milligram tablets. How many is in it? No, it's 2.
You get 100 of them.
And there's 200 milligram tablets. That's nearly 3 entire months of 400 milligrams a day, which I like to take for me because I have a lot of different pains and things. So I do, but I mean, if I didn't take it for, I mean, I could do 400 a day, 5 days a week, and skip 2, and I'll be fine. And
Right.
but I mean, with these 100 milligrams, it's a little bit like, I really wish I had the 200 milligram ones.
Well, maybe
Yeah.
I noticed the difference because I don't take any pain meds.
That's what I'm thinking. Yeah,
Yeah.
that's what I'm thinking.
That's what I use the CBD for pain. There's no side effects. Tylenol, ibuprofen makes me so sick. I don't mind a leave, but I know if you take it every day, it's not good for
Your
is it your
kidneys.
liver or your kidneys. And I
It's
just had that.
not good for your kidney or liver. I have to get mine tested every 3 months because of all the stupid stuff I'm on.
Yeah. And since I can do the CBD and I don't have any of the side effects, that's what I do.
I think it's amazing that you don't have to take pain pills. Like the first time you told me that, I actually prayed. I was just like, please let her always be able to do that.
But if,
I-
but if
I
you
would
can,
like-
if you can manage your meds, your pain meds a lot more if you're able to do the CBD as well. You know, because I like to use the both. I have to use the both of them.
Yeah.
And I'm probably in the best shape I've been in 10 years. Usually.
Yeah. See, I'm not allowed. If I go to my pain doctor and it's in my urine, it's considered taking a drug
A
against the other drugs.
CBD.
Yeah,
Oh no, I'm sorry. I'm talking CBD THC, not CBD. CBD I can take all day long.
okay.
And I recommend it for everybody. I mean, it
Yeah.
takes away a lot of pain that you don't necessarily need to have. You don't have to
I
have,
think it helps my inflammation a lot.
and it will help that too. You know.
That's what in my knees, that's what I get in
But
my
in the high concentration that we're taking it, I mean, a lot of people don't take that much of it, so they say, "Oh, CBD, it doesn't work." But
yeah.
that's not true. If you're taking 10 milligrams and you took 10 milligrams every single day, after 3 weeks, you would start feeling better to the point that you didn't even realize that's what it was. But you have to always be taking it,
Yeah.
you know, and it does help, you know, to where you don't have to swallow all the pills to make yourself feel like a human.
Yeah.
CBD is, I think that we all should use it in conjunction with what our medical needs are.
Yeah.
You
Well,
have
the
to
more we
approve my
use it-
thing because I put a link in. So
Where?
I'm not a moderator.
Oh, I'll make you a moderator.
Okay.
Are you in the chat too? Put a message in the chat for me.
You should have to approve my last message. So
I didn't see anything. Yeah, it didn't show up.
there, I put an emoji in.
There you are. Okay. All right. So add as moderator.
Call me before you make that order, sister.
I will. I've got to wait till I get my check.
I'm tempted to order some of the gummies that I keep seeing advertisements for on YouTube.
Mhm.
'Cause that would save me 160-mile round trip.
Yeah. Can you? But the THC, see, because the balm you have, the balm I have is just straight up CBD.
I have had the CBD one, and it works very well as well. Because there's two different kinds of this. There's the mix, and then they also have just a straight CBD one.
Okay. So for my big stick like that, I only pay $16 on
This
Lazarus.
was $23, $25 because Washington has sales tax and Oregon doesn't. So
Yeah. So I do use the THC, but that's usually just as a relaxation type thing.
Yeah.
Because I tried the sleep CBDs with the THC in them, which I have a bunch to give you, my sister. And what happens is I wake up in the middle of the night and I have the munchies. And,
if I can get to sleep, really, really get to sleep, then I can sleep through that whole thing.
yeah, I
Which
don't.
I love.
Chris was like, no.
Otherwise, I wake up and I tell Andy, I roll over and I hit him on the shoulder. Something's wrong with my blood sugar. Every freaking time. Every time.
Yeah,
It's
yeah.
crazy.
Oh, I get so
I
hungry.
only get the
That's my
munchies.
diabetes.
I only get the munchies if I haven't had an appetite for a few days, and
Yeah,
then
then he
no.
looks at me and he's like,
I just eat
don't.
everything.
Yeah.
That's the side effect that my body has for THC. It's like eat everything. Make sure it's a lot of sugar too, so your diabetes will go crazy.
Right? Yeah, that's what mine does. And then I'm like, yeah, effer.
Wilma says I do that too. Yes. Yes, it's a side effect. Like I don't get paranoid or anything, but I get some munchies so bad.
Okay, I just typed it in. It's not like,
Harrisgarden.com.
yeah, that's who does this.
Mm-hmm.
So
Wilma said I just had to eat an oatmeal cookie. Her sugar dropped. Yeah. Yeah.
Oh, I had to eat more than one oatmeal cookie yesterday because I had my gummies yesterday. Yeah, that's what happened.
I on purpose did not take anything today, and I won't take anything tonight because tomorrow I have to go get my migraine treatment. So I have to function, and I have to take my husband in to get a test done at the butt ugly crack of dawn.
Oh.
So
My daughter made some brownies that will knock a migraine out so fast you will never even know you had one.
oh, these migraines,
You're fine, Jamie.
part
Go ahead.
of them, part of my migraines are ocular because I have a spot in my eye caused from one of my medications, and I also have diabetic retinopathy, so I'm actually going blind. But so that affects it because my glasses prescription, I swear to God, it changes every day, and it does because of my sugars.
Mm-hmm.
So if my sugar's too high, I can't see. If my sugar's too low, I can't see. Everything just kind of goes, woo.
Yeah. It's definitely a big deal, diabetes. It's
Oh my gosh. If it's too high, I can always tell when I'm okay baseline pain, you know,
Mhm.
I can always tell when my sugar's going up and
Oh, you-
going up very quickly because it feels like razor blades are going through my veins.
Oh. It's because it affects all your other issues as well.
Right.
Okay.
Yeah.
Yeah.
My
'Cause I don't
diabetes
notice
is
it.
actually a symptom of my PCOS and my kidney birth defect.
Okay.
I forget what they call it. My left kidney is half the size of my right. And it has put me into stage 3B kidney disease.
Oh.
The left kidney only functions at 12%.
Okay.
So it sucks.
Yeah, well, mine does that. And,
Yeah.
I've been so many diabetic tests because I get nervous because my sugar drops that I'm diabetic, but I've done every test that they can do, and they always say you're not pre-diabetic and you are not diabetic. So I guess
You're hypoglycemic. That's what Andy is. He can literally eat a full, like 3-course meal and then have ice cream cake afterwards, and his blood sugar will drop to 35.
Yeah, I don't know. Maybe I'll need to tell them that because that's so weird.
I would, because it's just as dangerous.
Oh yeah. That's the one that will make you pass out.
That's the one that makes you have seizures.
Yeah.
That's why I had my seizures. I had 3 seizures. Not fun.
So that was like part of high diabetes or high
No,
sugar?
my blood sugar dropped to an unreadable level.
Oh,
I
okay.
was dying. Literally dying. And because I have small vessel disease, they couldn't get a vein anywhere. They ended up putting one up here. They poked me 6 times before they got the glucose drip in. So 3 hours I had a seizure for.
Oh my
Oh,
goodness.
wow. Jeez.
Did they say anything about any type of brain damage after that? That seems like a long time to have a seizure.
They didn't. I know that I have had some brain damage from it. More short-term memory loss, things like that. I have a lot of cognitive memory issues.
Yeah.
So and my husband, he's like, we're screwed because he has white matter disease. And he got hit by a car doing 55 miles an hour when he was 9 and it caved in his skull. He's my miracle. But yeah, so he usually is like, you have the better memory. I'm like, not anymore, babe.
Wilma says she has seizures as well, and that they're long like yours are too.
Yeah.
And her loss of memory she has loss of memory as well. So
right. You can't have a seizure and not have some kind of cognitive effect from it.
Mm-hmm.
So
I don't think I've ever had one. Jason has had one, but I cannot recall if I've ever had one. I don't think so.
I've only ever had one grand mal. I've had 2 for certain. Another one is still kind of up in the air. What they call mini mal seizures, and those look like you're just zoned out and people can't communicate with you. I had one when I was in San Diego with my dad for my little sister's wedding, and my dad, being the ginormously lovable person that he is, he said that I sat on the edge of the bed for 3 hours completely unresponsive, and he got so pissed at me. He's like, now we have to go buy breakfast instead of getting the continental breakfast. And then he said, I'm not going to miss my daughter's wedding because of you. I was like, okay.
Okay, Wilma.
I didn't even know what the hell had happened.
Yeah, so, you wouldn't.
Right.
Jimmy had one seizure 20 years ago and her shoulder came out of its socket.
My grand mal seizure, I fell off the bed. Like, our bed goes this way in our bedroom, and our bed's this high off the ground. So I fell onto the dog bed, and I tried to stand up, fell back, hit the back of my head, and then our bathroom is right here. So our bed's like this, and our bathroom's over here. And I ended up in the bathroom thrashing in the door jamb. Andy tried to put pillows in between me and the door jamb, but I kept throwing them out of the way. And I ended up cracking 2 ribs and bruising them more than anything, and kind of hairline.
That's painful too. I've done that. That's more painful than I thought it was.
Ribs are the worst. Break them completely. Don't crack them. Because cracking, it is the worst.
I fractured mine. It hurt.
But I also ripped the very inner ligament tendon. I always forget what it's called. In my hip, and they had to go in. It's between 1 and 4 stitches. You get, elderly people are the most common that have that injury, and I had 3 stitches. So I did a good job.
Now, Crystal, when you say your pain comes and goes, is it always related to something, or it just comes and goes? You just don't know.
No, it's always in my joints. It's always in my knees.
But like, is it always weather or being?
What happened, Joe? What happened?
Did your internet cut out for a second?
We lost you just for a second. Mine is all joint related. It's all arthritic pain.
Does it get worse with stress?
Oh, yeah. The stress and the weather.
Yeah.
And like I said, if I can't sleep, if I'm stressed, all the medicine I have for my sleeping and for my depression and all that, and the CBD, That doesn't matter. If I'm really stressed, I'll stay awake.
Yeah,
Don't-
that's what happens to me.
The only thing that my doctors will always say that, and I think doctors in general say this, they'll be like, well, you know, let's do what we can not to be stressed, or let's do what we can not to be anxious. That's not the way it works.
Why don't you, doctor, do that?
Do
Yeah,
you think that I'm not trying to not be stressed?
it's like a common thing with my doctors. They're always like, yeah, let's, you know, I know you're doing this and this, but let's try really hard not to be stressed. And I'm like, if it was that easy, I definitely would have already done it.
Yes.
Right?
Yes. If it was that easy, I would be just like not stressed at all. But now you're stressing me out even more by telling me that I shouldn't be stressed.
Yeah, pretty much. That's exactly it, Crystal.
Yeah.
Or making you feel like if you magically lost 100 pounds and removed all the stress out of your life and, you know, and maybe got some counseling, you would be fine. Hey, okay, so we obviously in this pain community and chronic illness that causes chronic pain as well, we all have to be our own advocates. And
Yes.
basically, I had one of my really good doctors, my kidney doctor. I adore him. He's like, you have to educate yourself, and basically you have an honorary doctorate in what's wrong with you,
Yeah, absolutely.
because we have to
Be your own advocate.
right.
Yeah.
You have to be your own advocate. You have to fight the it's in your head bullshit.
Yeah.
Excuse my language. From all the doctors, you find that even doctors that you have been with for a very long time and trust your care, and they know you and they know what's wrong with you, do you find that sometimes even them give you the it's all in your head crap?
Mine now don't. The ones I've had in the past did,
Yeah.
but mine now don't.
Yeah. Yeah. Like I'm 54, so in my 20s I got a lot of that.
Orion.
Yeah.
Yeah.
Say hello to Orion.
Hello, puppy. He's so cute.
He's
Well,
my
my
baby.
dog's ringing the bell, which means he's got the potty. So I'm going to go ahead and get out of here because I'll be out there longer than you stay live.
Oh yeah, yeah. We've only got like 10 minutes left.
All right. Love you guys.
He's
Lucky-
yelling at me because my sugar is low. So
He's what?
he's yelling at me because my sugar's low.
The dog?
Mm-hmm.
No, I want to get have you trained him yourself?
Yeah.
You have? Okay, so I'll be messaging you because I want to get when we do get a new puppy, I want him to be able to tell me when my sugar is low or high, whatever.
Save an article of clothing from each extreme. Put it in a Ziploc baggie, and that will be your best tool.
Okay. So
Um,
like when my sugar's high, save a piece of clothing, and when it's low, save a piece of clothing. Okay.
Yeah. Like I have a nightgown that I use to reinforce. You have to keep reinforcing the training.
Okay.
But like I have a nightgown that is just, I wore it and I crashed really, really bad. I think my sugar got to like 30, 32, something like that. So that one is very specifically for low blood sugar. And then I have a t-shirt that when I was in the 300s, the high 200s and low 300s, I save in a Ziploc bag. And you just bring it to them, have them sniff it for a while, and then you can take it away and they will, if a lot of it is if they have the gift. Like he does my sugars, but his mom, Coda, she is a cardiac dog.
Okay.
And I didn't have to train her for that because I didn't have cardiac issues when good night, good afternoon. it's not even noon for me. So have a good day, Wilma. But I didn't even train her for that. She picked up on that all on her own when I started having heart palpitations. And it was after I had COVID that my heart went kaput. I have my new cardiologist, praise her. I have COVID heart with small vessel disease.
Okay.
And they did a quadruple bypass completely unnecessarily.
What?
And then the wires failed. Yeah, they went in and did an angiogram. They were gonna do an angiogram. And they weren't even in there 2 minutes, and they're like, you're gonna have to have bypass surgery.
Oh.
And it was because I have such tiny veins.
Oh, okay.
And there again, that is linked to my birth defect with my kidney. And so I went through and get this, the surgeon told my husband, while I was in there, I was only supposed to have a double, possibly a triple bypass. So I prepared for the triple, of course. And he goes, well, I was in there, so I figured I'd just go ahead and do it.
If you didn't need it, why?
Well, and then he kicked me out of the hospital after 3.5 days of being there. I was only out of cardiac ICU for less than 24 hours. And he said, well, you can take care of your diabetes better at home, so I'm sending you home. All because he didn't want to give me more insulin or the proper amount of insulin or my diabetes meds.
Man, when I went into the hospital, they made sure I got my diabetes meds and they checked my glucose every 3 times a day at least.
So I put makeup on this because I don't like it to show so bad. It's constantly trying to separate. But the bottom half, well, all but this much of it, the wires failed. The closure wires, because they used wire on a big busted woman.
Oh.
And then didn't give me a wrap. Right? So I wasn't even out of the hospital and I was complaining about this horrific sharp pain going up into my left breast. And it was because the wires broke completely. So they did, I stayed like that for 6 months.
Ow.
Yeah, 6 months. Because I had surgery November 14th of last year. And then I didn't have my sternum repair until May. So 6 months. And when they finally did the imaging, my sternum was separated by that much. There was just this big black hole with wires going crisscross. Looked like a corset, where you've got the crisscrosses and the open gap. And so now they went in and I have 4 titanium plates that go across and ain't nothing moving. Let's just say that.
Had to put the titanium in there.
Yeah, I don't even know why they do the wires. It makes absolutely no sense because another YouTuber on here, she had to have a triple bypass surgery like a month after I did. Her wires failed and actually poked through the skin. And so she ended up having to go in and have a sternum repair and have the plates put in. Like I said, I don't know why they don't just do the plates to begin with.
It doesn't make any sense. Yeah.
It doesn't. Because, and she's not busty like I am. But, think about you reach this way and your pectoral muscles go that way.
Yeah.
So everything is constantly moving, spreading everywhere. And there's no stabilizing it.
No. We've got 5 minutes left, so I'm going to ask if there's any other questions. Anybody who's still here have any questions?
I've missed some comments.
Yeah, that's why I do this on the computer. If I do it on my phone, I have a little trouble.
Well, yeah, I took my glasses off, but I'm trying to find. I have a picture of the X-ray
Okay.
of my. I think with the opioid epidemic, as they
Mhm.
say,
Mm-hmm.
has caused so much upheaval for chronic pain patients. They've taken away options because of a few bad doctors over prescribing.
Oh, okay.
That's at least that's my
There were
opinion.
hundreds, by the way, of bad doctors. They were getting
Well,
payoffs and yeah.
in the grand scheme of things, it's a few versus the ones who have patients that, I mean, they're taking, I don't know about where you are, but in Oregon, they have drugs are legal, right? Any
Mhm.
kind of drug. You can get fentanyl pills for like $1.25 in Portland.
Oh, wow.
And a person who has cancer or has post-surgery pain
Mhm.
like mine can't get a 5 milligram Percocet even
Uh-huh.
without, oh my God, you're a drug seeker. Dude, I just got ripped open. And
Yeah.
have my tooth split open, and you're gonna sit there, or someone's dying of cancer. My neurosurgeon who did my neck surgery told me that he was sending me home with more pain medication than he would give a terminal cancer patient. And I looked at him and I said, "You've never worked with a real terminal cancer patient then," because he sent me home with 20 15 milligram extended release oxys. And
15 milligram.
yeah. And then he sent me with like 40, I think it was 40 or 50. I don't remember.
Hey, Lorna.
10 milligram quick actings to fill in the gaps. And that was supposed to last me 6 weeks until I saw him again.
6 weeks? That's
I
crazy.
looked at him and I said, "You're full of shit. I will see my regular doctor who prescribes mine and manages my pain."
Yeah. Yeah. It's so hard to find good doctors, good surgeons. It's easy to find mediocre,
Yeah.
but
Yeah.
it's hard to find good ones.
Well, and it's like the cardiologist here that caused all this upheaval with me ending up having to have unnecessary heart surgery. I've had to call the state medical board on her, and she managed to rope in my primary care doctor to bully me.
Oh.
He had a conversation with me that I was on my last chance with the hospital, and the hospital didn't need me or wanted me.
Oh.
So I was on thin ice. And I looked at him and I said, "Excuse me?" I said, "She's the one in the wrong." And I have since had to call the state medical board on her because I'm not the only person that she caused to have a freaking heart attack.
Yeah.
Not to mention an unnecessary, very dangerous surgery that she bullied me into. I said, "You're just taking her side." I said, "And that is losing trust between you and I." I
Yeah.
said, "What you should have said to the management that came to you and to her was, this is an issue between her and the patient, not me. I have to stay out of this."
Yeah. Jamie said she used to be on 60 milligrams TID oxycodone. What's TID?
Is that the slow release?
I used to be on 60 milligrams 3 times a day, 30 milligram 4 times a day, and methadone 10 milligrams. How many times a day? Till she got flagged. Then she lowered me fast. Yes, yes.
Yeah.
The only people who are being affected by this, they're not giving out the narcotics, are the people who are in pain, who are people who are in pain that need it. The
Right.
people who are on drugs are getting it illegally. They're using heroin now.
Yeah.
The people that aren't just doing it for pain. The pain patients are the ones who can't afford to buy drugs off the street and are trying to get their insurances to pay for pain medications,
Well,
but then the doctors won't give it to them.
they comply. A pain patient complies, especially well, at least all the chronic pain patients that I know, including myself, they comply with the contracts that they're given. They comply with keeping, taking their meds when they're supposed to and not abusing that privilege because they know how fast it can be taken away. And I'm sorry, I can't afford to, go buy street drugs, and I'm sure as hell not going to break my sobriety for it. But
No.
you can see, hopefully, the lines that go across.
No, I don't see.
There's
Let me blow it up.
There's one here, one here, one here, and one here. Maybe if I turn the brightness down.
Yeah, that might help.
There you can see it.
Okay.
You can see those are the plates that are holding my chest together.
Okay, I see them. Yeah.
And as soon as they put those plates in, I woke up from surgery and I looked at my mom and I said, "Oh my gosh, it doesn't hurt anymore."
Yeah, that's good.
Because that pain that was shooting up into my breast and everything, instantly gone. That nerve pain, all of it. So I think, I don't know. I have no trust in doctors anymore.
Well, I would say that what we can take away from that is that by telling us your story, if we have something like that going on, we know to ask for those titanium plates.
Right. Yeah.
Give them to us. Maybe we need to find another surgeon.
Yeah. Always get a second opinion. This whole journey, I mean, I knew before to get second opinions and things like that, but it has definitely made me a huge proponent. Get a second opinion, get a third opinion, even if needed. And don't take what they say as biblical truth. Do your research, figure out if there isn't, look at you. You've been able to get off of the pain meds and just take the CBD.
Yeah.
I would love
in the future, because arthritis is degenerative, it's not going to get better. So I know I'm going to end up on pain medication, but I'm going to wait until I have to because of the way they're treating people on pain medication.
Right. Yeah. I go into the ER. Trust me, that like rarely happens. I have to be dying. But if I go into the ER here, they immediately treat me like I am a drug addict. And I look at them and I'm like, the only time I ever go in there is if I'm having a kidney stone, or like right after I had my heart surgery, this whole part of my chest was literally spasming so bad I felt like I was having a heart attack.
Jamie's had that happen too. When she goes into the emergency room, they treat her like she's a drug addict as well.
Until they do that test, that magical test, and figure out that, oh yeah, you do have a kidney stone. I'm going to treat you different.
Duh. Now I have to say, I went into the emergency room for my kidney stones and I was treated pretty well. But again, I have a really good hospital. I don't go to my local hospital. I go to a hospital that's about 20 minutes away.
You're also not on narcotic pain meds.
That's true. That is true. Yeah. And when they do give them to me, though, they give me the lowest. It's Tramadol. And that's like pain med light. I've been told. And
Yeah.
another reason that I don't take pain meds is because I get that severe constipation with what is that called? With
The opiate constipation.
with the opiates, yes.
Yeah.
And I haven't got to the point where that is something that if I don't take, I can't function as a person. Like if I can't walk or something like that, then I'm going to have to do that. And
that's
then
exactly how I get treated, Jamie.
Yeah.
And I refuse to go to the hospital unless I'll sit at home. And I mean, if you've ever had a kidney stone, which you have, you know how absolutely agonizing it is. And I have had 9.
Oh my gosh.
Yeah. One of them, they had to blast, or they blasted it. And I only ended up passing about 1/3 of it. And they had to actually go in and surgically remove it and put a stent in. And oh my God, I had to use
I had the stent.
that 2 weeks. That was misery. I felt that stent the whole time.
Yeah. Yeah.
It's like, oh my gosh, you have no idea. And okay, on that note, the anesthesiologist comes in while I'm still in recovery from them removing this kidney stone, and she goes, "Your kidneys are in the worst shape ever. You need to be ashamed of yourself." And walked away. I'm like, are you kidding me?
Thanks for the info, lady. Like I didn't already know this.
Right? Like I didn't know I had a birth defect, that basically my left kidney is a prune.
I haven't had a doctor treat me like that. And I think I would go off. I really do. Because we pay them to take care of us.
Mm-hmm.
And if they're not doing their job, then I don't want to pay them. So if you're going to be mean to me because you got to do your job, well, then maybe I need to find someone who doesn't mind doing their job.
My grandmother was the head nurse at one of the biggest nursing homes in Portland.
The nurses are the sweetest, though.
It was her and then the guy, the manager over the whole thing, right? That were in charge of the place. And she always taught me, and she always taught her nurses, to never take any bad behavior from any medical professional ever. It is not warranted and it's not right. They're there to help you. I have had so many comments. I've part of a couple groups on Facebook that are pain related and chronic illness, stuff like that. And I've had several nurses in there talk about the tables being turned on them. They ended up getting cancer or whatever and had to have surgery, and then they get treated like absolute garbage by their fellow nurses.
Oh, wow.
And it's like, okay, you need to think about that. Mm-hmm. Think about how you're treating people. Would you want your daughter or your mother or your sister or any other family member that you care about to be treated like some junkie off the street when you know damn good and well they aren't?
Right.
I don't go to any doctor's appointment. I don't go to anything that has to do with medical without my husband present. Because it's like, I'm not going to go through this shit and not have a witness.
Right.
You know? And it's not like, I go in, I'm well dressed. Even in my pajamas, I still don't look like garbage, like some junkie off the street. I used to be a junkie off the street, so I know damn good and well what they look like.
Mm-hmm. Yeah.
So.
Yeah. Jamie said, in Pennsylvania, you have to be under 90 milligrams a day. When she went to her, I think this is a recent appointment, he told her she was lying about her pain level. So he told her to give him a number he can work with so he could justify lowering it. The doctors in Pennsylvania and where you're at, Jen, and because Joe and I both talk about, we both went through bad doctors. We finally found, I've been going to the doctor since I was in my 20s. You know, once you get your pap smear and whatnot. And so I know a bad doctor now. Now I'm 54, so I know a bad doctor now. And I just can't, like my knee doctor, I had to go to, they sent me to this guy that was supposed to be so good. And he said, well, your knees are really bad. The only option we have for you is surgery. And I just wasn't comfortable with him. So I went to another doctor and he said, yeah, they're bad. You're going to have surgery. But he then explained to me what the surgery was going to entail.
Right. And that's
I
what a good doctor should do.
Why is that so hard for them? Why?
Because they have a God complex, especially surgeons. They really have a God complex because if you are in the surgeon's office, you have tried everything.
Yeah.
You know, and so they have the power, and they get treated like that. They get this elevated status that they're the miracle workers that can fix what everybody else can't.
How dare you question them? I need a doctor I can ask questions from. I'm a control freak. I need to ask questions.
Right.
I've always been like that.
Informed. Yeah.
Yeah.
I'm not going to just blindly take whatever you prescribe me.
Yeah. I can't do it. It's just, I have to be my advocate. This is my body. I pay you to help me with it, but you may or may not have my best interest. You know what I mean? You may have your best interest before mine. And I want to come out of that surgery better, not worse.
Yeah.
You know. Okay, it's 3:12, so we've gone over a little bit, but no big deal. I've had a wonderful time chatting with everybody today. And you, Jen, thank you so much for coming.
Thanks for having me.
So I think this has been a really successful chat. We've had a lot of questions and comments, and I think everybody really enjoyed this. So I hope to do this again. And yeah, I probably won't be able to do it at night, but what I'll do is I'll contact you. And if you can, you can. If you can't, you can't. You know, no worries.
Yeah.
I'm going to leave that chat up.
Yeah. Unless it's a day like today where we've had such a bad evening and night. I am in bed until an hour from now.
That's fine. But I'm glad you could come. I'm glad you could come today. So
yeah, and I hope you feel better, Jamie.
Yeah, Jamie. The DEA is on their backs, and regardless of your pain, they only care about their job being launched.
Yep, exactly.
Yeah, so it's horrible that it's come to that. Once the government gets involved, it's no longer about the patient.
Well, and here she's talking about it being 90 milligrams a day. Here it's 30. So I hope you ain't dying of cancer.
Or you better start smoking some pot.
Right? Yeah. You gotta find
that just numbs you all day, basically. So.
Yeah. I don't like that head space that it gives me. So that's why I like stuff like this. Or I'll take the mood altering one if I'm going straight to bed. Because then I don't have to deal with it.
Yeah. That's the only, I use that for sleep. And I had to stop. Like I told you, I'd wake up and be hungry. I used to be on 300 milligrams a day down to 90. Jeez. I think as soon as you can, you're probably going to get that pump back in, though. I think we've talked about that, Jamie. Okay, I'm not going to keep anybody any longer because we're 15 minutes over.
Yeah. If anybody wants to ask questions or whatever, you can hit me up on IG. So.
Okay, so everybody have a great day. And we will see you in the next video. Bye, everybody.
Bye. Thanks for having me.